I want to make sure I get this right, that since the opioid crisis has started, we have lost more people due to the crisis than in all the times that our country's gone to war.
Combined, beginning with the American Revolution till today. And it's mind-boggling, hard to get your head around, but that's actually true.
So, we love, you're most powerfully positioned to serve the person that you used to be. And we told your story on the last one. They can watch I highly recommend you watch the Dope Sick on Hulu. It's phenomenal.
Right.
And just for what it's worth, there's some of the story that's fiction. Let's just give them the recap so when they go watch it, they know what they're watching, right?
Well, the story is based on a fictional doctor in West Virginia who basically gets addicted to the medications he prescribes. And that's exactly what happened in my life in the early 2000s when I was a young doctor. The parts of it that are fictionalized, obviously it's in West Virginia. I'm a Johnson City boy, East Tennessee. So those things all happened. They just happened in East Tennessee. And really there's only two parts of it that are kind of Hollywood. One is I didn't relapse. If I make it till next month, it'll be 21 years, which still is hard for me to get my head around because there was a time where I didn't believe I could go 21 minutes, let alone 21 years.
Right.
And then the other thing is that I never bought a school bus. In Dope Sick, the Keaton character buys a school bus because he's taken so many people to treatment. And looking back on it, Nick, through the years, I probably should have bought a school bus.
It's a good idea, right?
It is a good idea, but the rest of it is all happened in the worst day of my life. Is in that series. Absolutely. I bought drugs from a patient of mine, and he taught me how to rub the coating off of the OxyContin and snort it, and that's depicted in the show, and it happened in my life.
Wow.
Yep.
Wow. Well, so when you hear a couple of years ago, honestly, the numbers and the statistics were mind-blowing. I guess this touches close to home for us, which we've talked about before, but you don't realize the scale. The scale is unreal. The
scale's hard to get your head around. I mean, if you look at every person who has this issue touching 7 people, that means that about 75% of Americans are affected one way or other, friends, family, coworkers. Yet it's the thing we don't talk about. And even getting to know you and Rihanna, right?
Yeah.
And so it's like this thing we have that's out there that's absolutely dominating our lives, yet we don't talk about it. And there's a lot of reasons for that. And I think the biggest two are obviously shame and stigma. But the thing that kills me about that, Nick, is it's so treatable, right? And people come out on the other end, and they always like to hear the dirty underbelly, right? All the stories of this and that. But the beautiful side is on the other side of it, which is in recovery, and why I get to hang with you.
That's right. What's a couple of years ago, we're always learning. We've learned a lot, I'm sure. What's some of the biggest things that we've learned in the last couple of years? And are we making any dents in it? How are we doing in the fight against it?
Oh, we're making dents in it big time right now. A lot of the efforts that we've had for the last 10 years are really starting to pay off in blanketing areas with overdose reversal drugs. Everybody recognizes the name Narcan, but there's multiple drugs that do that now. So that's the first step is saving people's lives. And I think the biggest things that we've overcome, Nick, and since I've talked to you, is actually more and more people are seeing it. And, I've been out there beating this drum for a long time, but, I had a friend of mine tell me, he said, Steve, just when you're tired of saying it, that's just when people are starting to hear it. Right. And so we've kept that up, through the years. And there's now so many people, many more people on board. We live in Nashville, which for me is a great city, right? We've got the country music industry. We've got people in that industry starting to come online and get involved in this. And, my friend Ryan here in Nashville has done a great job with that and making this, bringing it mainstream because so many people are affected, Nick, but so many people can come out on the other side and they actually don't have to die.
Right.
And for me, there's still too many people dying. I don't care if there's one, then that's too many.
Right. So, if we had to break this thing down into into stages, right? So obviously the addiction would be phase 2 because the intro would be, you got to get introduced to it first,
right,
to get addicted to it.
Right.
And then after addiction, then that would lead to recovery, and then I guess life after recovery.
Yeah, we call it long-term recovery, and people will describe themselves as that. I'm such and such, and a person in long-term recovery. But Nick, it's really funny because the roots of addiction go back to genetics.
Yeah,
right. I always teach addiction is genetics, trauma, and opportunity. Right. Slot machine, 3 sevens come down on the pay line. That's when the money comes out the bottom. So you can look at your risk just from your family history, and then trauma. Right. We almost never touch on this. People don't like to talk about it growing up. Physical, sexual, emotional abuse. And one of the things I always like to emphasize here, it's not about blame. Right? I'm not blaming it on that.
Yeah.
it's kind of how we got where we are.
Yeah.
And so when I started to figure that out, I was like, well, if this is how I got how I am, then there's something I can do about that going forward. So genetics, trauma, opportunity, then the addiction, right? Then the intervention, treatment, and then recovery, and then long-term recovery.
Treatment, then recovery. Yeah, treatment.
Absolutely.
Okay, that makes sense. Let me put that in there. And the reason that I was, kind of asking about that is because, the guys from Troy Sandifer from Hustle Recovery, Dr. Aaron Pryor and Justin Lowry from Smiles for Recovery. They've been on the show. I've been helping them out with some stuff. It really like brought things full circle based on conversations I'd even had with you about the Narcan and at the end of the day, it's all about if they're not alive, there's nothing to save, right? So you got to keep them alive first and foremost. How do you do that? And it's amazing how people, giving people teeth can give them purpose and help with the relapse.
Yeah. Long before I met Justin Lowry and the people at Smiles, who, by the way, I love, I knew this. I was seeing it I was taking care of pregnant women who were, using heroin and fentanyl. And when they got into recovery, the most shameful thing that they had were their teeth. Mm-hmm. And, luckily I was in East Tennessee, small place. I knew a bunch of people, right? And we traded favors. And so I had some dentists that I'd done some favors for, and they started helping me with my patient's teeth. Mm. And I remember the very first one that I sent, and I want to give him a shout out, Bo Westmoreland, a dentist in Upper East Tennessee, who our kids played ball together, baseball. Right? We're all baseball guys. And I sent her to Bo's office. I said, Bo, she doesn't have any money. And she's trying to get a job. She's educated. I said, her teeth are terrible. I said, they're a great source of shame for her. So I sent her to Bo, and she called me later that afternoon. She was crying. And I started to get hacked, Nick, actually. I was like, what's she crying for? And I said, honey, you okay? And she goes, Dr. Lloyd, I've never been treated so well.
Wow.
I've never been treated with more respect than what I was treated with. And Bo fixed her teeth, and she got a job. Matter of fact, she's doing great today, raising her kids. She just got engaged. I mean, this is what I'm addicted to now, Nick. Right? I mean, I get to see this, but it started with the teeth, and now she had confidence, and her smile lights up a room. And when you see her, like, yeah, I'd hire her. And I don't think people realize what a difference that makes, right? If you look at years of things that we do to ourselves in our substance use, they're very difficult on our teeth. Starting with, marijuana, weed is very difficult on your teeth. If you have somebody that's using methamphetamine, it's like acid for your teeth. Just eats them out of your head. And then how shameful it is when you get in public in recovery and you smile, or you want to smile but you can't, because you know what? It's absolutely devastating. And then to watch the change in these folks as that gets corrected is just amazing. And so I love these guys for doing it, and that's why we partner with them.
There's a quote that's gone around a gazillion times about that. Your past is just a past. It's not a life sentence. You know what I mean? But, becoming an addict is, unfortunately, whether it should be or not, it's probably one of the most shameful things that a human being can go through. And then, and when it literally rots, when you've lost your teeth, every day when you look in the mirror, it's like, can you imagine how it's hard enough to overcome something like that on your own anyways. And then every time you look in the mirror, you're reminded of it, and you're reminded of the person that you used to be versus the person that you're going to be. I can't imagine how difficult that must be.
It's today's scarlet letter. I mean, every single time that you look in that mirror, you're reminded.
Yeah.
And I don't want to forget my past. And in all honesty, I don't want to change it. But you can also go the other route with it and remind you of who you are, remind me of who I am. And then if I go down the toxic shame side of that, next thing I know, I'm right back in that wallowing and don't feel like I belong or I matter, which are the two most important things that human beings have to have.
Yeah.
And so it's devastating for you, right? Yeah. And if you don't belong and you don't matter, I mean, you can see yourself going back down that cycle and being covered up in shame. And in all honesty, Nick, we know how to relieve shame. Right, we can alter ourselves.
Oh, yeah.
We have experience with that, and the teeth thing. I just I don't want to beat it to death, but it is so big, right?
Yeah.
And I look at myself. My teeth never got that bad, but they did get to the point where I just wasn't taking care of myself overall. Weight, eating right, all those things, and when I started doing that, I started taking care of myself. I got better in my job. I got better in my interactions with people just because of the confidence I had.
That's right.
It's amazing.
That's right. Well, it's, a lot of times when you think about an opioid crisis or any drug crisis, you think of the low-income parts of town. You think of the trailer parks, the ghettos, and stuff like that. But, you know, I got to tell you, as a dad of a 15-year-old son, like, I think the thing that's most mind-blowing for me is how it has penetrated the best neighborhoods, the best parts of town, and how, like, it's such a, I mean, there's no way to know that it's there. Like, so, like, it's in more than we think. Right. So as a dad, I'm like, what should I tell my son? How should my wife and I go about, we got a teenager, he's going to be hanging out with friends, less adult supervised. What would be some advice you could give for parents?
Nick, I'm not condoning any of the things that we did growing up, and I'm a little older than you, right? Yeah. But you know, when we were growing up, it's not the world we live in today, right? We drank, we smoked some weed. You know, I grew up in the 80s, so there was cocaine, but heck, we were never rich enough to have that anyway. Right. You know, I mean, so it might as well have been, you know, it was on Miami Vice.
That's right.
And so how that's changed today is, first of all, the marijuana and the THC products are so much more pure. They're made in labs, not grown in somebody's basement or in their closet. You know, so the THC content is so much higher. So whenever you're using that, your inhibitions go down and you're liable to try anything, right? I mean, you're much more in risk taking. And here's the problem with that today. The problem with that today is you don't have to be a continuous user. You can use one time and die.
Right.
And I tell people all the time, today if I decide to relapse, my gosh, I'm 21 years old, I've got an ID, I've got money, and there's a liquor store within probably 2 miles of where we're sitting right now. And I can do that. And it'll take 20 years of hard drinking to kill me unless I have a wreck. If I decide to use pills or heroin or fentanyl today, I'll die this afternoon. That's the deal.
Yeah.
And so, you know, I'd encourage you to talk to your kids about this. It's what they don't realize. I mean, you look at these things, and I've been to parties, even in the 80s, I've been to parties where we had pills. People got in their parents', you know, medicine cabinets, right? Xanax, Valium, Klonopin, you know, those type things. It looks like just what comes out of the pharmacy, right? I mean, you can't tell, I can't tell the difference.
That's right.
And instead of being what you think it is, it's fentanyl. And you get a hold of the wrong one and you die right then. And it's not this struggle, right? It's not this, you know, this prodrome of going in and going down to your knees. I mean, you literally take a breath and then you don't take the next one.
Yeah.
And that's the thing that parents have to understand and keep with their kids. I mean, you and I were talking before we got started here about, you know, sharing stuff at the county fair.
Yeah.
And you're spot on. Man, you're spot on about that, because you just don't know. And this whole, you know, only touching people on the other side of the tracks, right?
Yeah.
And that's really the one that gets me. I've got this group of moms in Williamson County that I think are absolute warriors. I think they're studs. I don't have better words for them. That lost their kids to drug overdoses.
Wow.
Did CPR in their kids in the beds that they grew up in as children.
Wow.
And Williamson County ain't exactly hurting, okay, if we're honest. And so, you know, educated at Harpeth Hall, you know, the finest of schools, yet, you know, here's this thing underlying. And we don't want to talk about it. And the reason I love these moms so much is because a couple of them actually wrote it in their kids' obituaries.
Wow.
And I said, you know what? And I went and found them, right? And I know them well now. And when we start getting things like that, and we have people that are willing to be that vulnerable, then that's where we start to move the needle. Is things like that, and we do have that in Williamson County with a lot of our parents there.
It's so hard to fear something that you've never seen or touched before.
Right.
That's the hardest thing for me, is like, you know, I can show my son the most horrible car crashes. You know what I mean? I can show my son moms and dads talking about the loss of losing a child, siblings, and you can hear about the loss from fentanyl, but like, again, like I don't know if I've ever seen it or not. I don't know if I've been in the vicinity or not. I don't take things definitely that I don't know from, especially from people I don't know, but I maybe I've touched it, maybe I've been around it. I have no idea.
Well, Nick, we're in the fourth opioid crisis in the history of our country. First one, the Civil War. Second one in the 1920s and the early 1970s, and then today. Today's is so much worse because of what you just said.
Yeah.
Okay, because you look at a pill. This came from a doctor.
Yeah,
well, it's not bad, right? But I wouldn't have it if the doctor didn't think I needed it, and even if I'm buying it for somebody, it came out of the pharmacy, so it's fine, right? And that's it. It looks so innocuous. I still talk about this because I can't believe I got to the point in my life where I woke up in the morning and I couldn't go unless I had this little thing.
Yeah.
How's that possible? I mean, I'm educated. I have money. I have a job. I have cars that I never dreamed I'd have when I was a kid.
Yeah.
How did this happen? And I think that's the point, because it's not, a needle in somebody's arm laying underneath the bridge, although it does turn into that. And the line between that person laying underneath the bridge and the kid who's using in Williamson County going to private schools is a very, very fine line, Nick. You say, well, I'm going to take pills, but I could never stick a needle in my arm. You'd like to think that, right? And then you get desperate enough, and maybe you can't stick a needle in your arm, but the person who's with you can stick you, and then they teach you. I can't tell you how many times I've heard that one.
Wow.
So you're spot on in your analysis of it. It looks innocuous. Can't hurt me. And pretty soon it's dominating you. And then if you get a hold of that pill that's what you think it is, and it's fentanyl, and again, I can't tell the difference, then you die. And that's the part that really is scary. I've got a grandchild. She's 18 months old. She lights up the room for me. And sometimes when I'm watching her play, I wished I could just keep her right there with her toys in my living room. And you and I both know that ain't going to happen, just like your 15-year-old son.
Yep.
So how do we arm them going forward with this? Because we all face this stuff in school, right?
Yeah.
We were out there. You know what I'm talking about.
Yep.
But, guys, it's different today. It is markedly different. I had somebody not long ago tell me, said, Steve, addiction hadn't changed in the last 100 years. Probably the roots of it haven't. But if you think the landscape hadn't changed in the last 100 years, you've got your head in the sand.